We're going to start with Medicare Advantage with for all of you who watch my program on a daily basis, you know that I interviewed Diane Archer of the organization called Just Care USA. She wrote an op-ed in Common Dreams that I want us to cover today because it's important. December 7th is a deadline to enroll in Medicare Disadvantage, in many Medicare Disadvantages. They call it Medicare Advantage. Remember, it is really Medicare Disadvantage. Why? Because it is run by the private sector who is taking our tax dollars to transfer it directly to shareholders, executives, and whatever is left over, they go ahead and give you health care. Remember that. They like to say it the other way around. They like to say they efficiently provide health care. Whatever is left, they then give it to it's a profit for but that's not what it does. They ensure their profits first. And that's how they go about scamming you. I repeat, that's how they go about scamming you. That's how they go about scamming you. All right, let's get busy. And let me put that on the screen so you guys can kind of take it along with me. But I want you all to pass this article around. I have it inside of the blog, but I'm going to put it in a chat as well. Let people read this article. But for our podcast, we need to go through it right this minute. So here we go. 7 questions to ask to protect yourself from Medicare scams. So actually, let's reintroduce this. Diane Archer, she is the president of Just Care USA. It's a very important organization, an independent digital hub covering health and financial issues facing boomers and families. It's an important organization. We've interviewed her before here on Politics Done Right. To ensure you have good coverage for both current and unforeseeable health needs, this open enrollment period, you should choose traditional Medicare. 7 questions to ask to protect yourself from Medicare Advantage. All right. During this Medicare open enrollment period, ask yourself these 7 questions. And please know that you can always call the Medicare Rights Center at 800-333-414. Or let me repeat, that is 800-333-414, or your SHIP State Health Insurance Assistance Program for free, unbiased advice on any of your Medicare questions. Again, that is 800-333-4114. What are these 7 questions? The first one is, what is the biggest difference between traditional Medicare and Medicare Advantage plan? Second question is, should I trust an insurance agent advice about my Medicare options? The simple answer is no. Why can't I rely on my friends or the government to star rating systems to pick a good Medicare Advantage plan? We're going to talk about that. I am enrolled in Medicare Advantage plan. Can I count on seeing the physicians listed in the network and lower costs? No. Doesn't the government make sure that Medicare Advantage plan delivers the same benefits as traditional Medicare? No. If I join a Medicare Advantage plan, can I disenroll and switch to a traditional Medicare? We got to talk about that one. We're going to talk about that one. If I have traditional Medicare and Medicaid, what should I do? We're going to talk about that. So let's go to the first question. What is the biggest difference between traditional Medicare and Medicare Advantage? According to Diane Archer, and this is a fact, to ensure you have good coverage for both current and unforeseeable health needs, you should enroll in traditional Medicare. That's the only guarantee of good health care, not the private system called Medicare Advantage. If you have the ability not to do it, do not do it. In traditional Medicare, you and your doctor decide and the care you need with no prior approval. And you have the easy access to care from almost all doctors and hospitals in the United States with no incentive to stint on your care. In a Medicare Advantage plan, a corporate insurance company decides when you get care often requiring you to get its approval first. Medicare Advantage plans also restrict access to physicians and too often second guess your treating physicians, denying you needed care inappropriately. The less care the Medicare Advantage plan provides, the more insurance company profits. You will pay more upfront in traditional Medicare if you don't have Medicaid and need to buy supplemental coverage, but you are likely to spend a lot less out of pocket when you need costly care. Regardless of whether you stay in traditional Medicare or enroll in Medicare Advantage, you still pay your Part B premium. See? Should I trust an insurance agent about Medicare Advantage? No. Unfortunately, insurance agents are paid more to steer you away from Medicare and into a Medicare Advantage plan. And remember, Medicare Advantage is not Medicare. Medicare Advantage is not Medicare. Medicare Advantage is the same lousy private insurance that most Americans have. That's all it is. The only reason it's there is because old people, they never insured because it costs too much. So now they get the government to overpay them for insuring older people. Continuing. Unfortunately, insurance agents are paid more to steer them away from Medicare. While some insurance agents might be good, you can't know whom to trust. Keep in mind that while Medicare Advantage plans tell you that they offer you extra benefits, you still need to pay your Part B premium, and extra benefits are often very limited and come with high out-of-pocket costs. Be aware that many Medicare Advantage plans won't cover as much necessary medical and hospital care as traditional Medicare. It's important that you get that. Why can't I rely on my friends or government to steer me to the right Medicare Advantage plan? Unlike traditional Medicare, which gives you easy access to physicians and hospitals you use for everywhere in U.S. and allows for continuity of care, you can't count on Medicare Advantage to plan to cover your care from the health care providers listed in their network or to cover the medically necessary care that traditional Medicare covers. Even if your friends say they are happy with their Medicare Advantage plan right now, they are gambling with their health care. The government's 5-star rating system does not consider that some Medicare Advantage plans engage in widespread inappropriate delays and denial of care. And other Medicare Advantage plans engage in a different bad acts that can endanger your health. So while you should never sign up for Medicare Advantage plan with a 1, 2, or 3-star rating, Medicare Advantage plans with 4 and 5-star ratings can have very high denial and delay rates. Okay? Número 4. If I'm enrolled in a Medicare Advantage plan, can I count on seeing the physicians listed in the network? Hell no. Unfortunately, provider networks in Medicare Advantage plans can change at any time, and your out-of-pocket costs can be as high as $8,300 this year for in-network care alone. You can study the Medicare Advantage plan literature, and you can know your total out-of-pocket costs for in-network care, but you cannot know whether the Medicare Advantage plan will refuse to cover the care you need or delay needed care for an extended period. This year alone, dozens of health systems have canceled their Medicare Advantage contracts, further restricting access to care for their patients in Medicare Advantage because Medicare Advantage plans make it hard for them to give people needed care because they lowball them. They try to take, no, I'm not going to pay for that. Number 5, doesn't the government make sure that Medicare Advantage plans deliver the same benefits as traditional Medicare? Hell no. The government cannot protect you from Medicare Advantage bad actors. The insurers offering Medicare Advantage plans can decide you don't need care when you clearly do, and there's no one stopping them. They are largely unaccountable for their bad acts. In the last few years, there have been multiple government and independent reports on insurance company bad acts in Medicare Advantage plans. Number 6, if I join Medicare Advantage plan, can I disenroll and switch to traditional Medicare? You can switch to traditional Medicare each annual open enrollment period. However, there is a caveat. Dependent upon your situation, where you live, your income, your age, and more, you might not be able to get supplemental coverage to pick up your out-of-pocket costs and protect you from high costs. Why? What's worse, you could incur thousands of dollars in out-of-pocket costs in Medicare Advantage. That is, you have to go back to the actuarial tables. You have to go and be when you just, if you're 65, as soon as you enter, if you go for Medicare immediately, not Medicare Advantage, which isn't Medicare. So from now we'll call it Medicare Disadvantage. If you just go for standard Medicare, the supplemental have to take you at the current best cost that they have. If you go from Medicare, if you go at 65 right into Medicare, but if you go ahead and started with Medicare Advantage and the next enrollment period you switch back, they can say, your rate's going to be higher, and you're kind of sick. And because you're kind of sick, what we're going to do is we're going to put you through the actuarial tables again, and we're going to charge you an arm and a leg for covering you. Folks, it's a ripoff. Medicare Advantage is a scam. Lastly, 7, if I have traditional Medicare and Medicaid, what should I do? If you have both Medicare and Medicaid, traditional Medicare covers virtually all your out-of-pocket costs. You will get much easier access to physicians and inpatient services in traditional Medicare than in a Medicare Advantage plan if you need costly healthcare services or a complex condition. Again, call 800-833-4144 for your Medicare rights, folks, for your Medicare rights. Remember, this is very important. I cover this frequently. I cover this often. I cover this vociferously because the private insurance company are scums that, and I try not to use these offensive words, but anybody who causes the death of people, anybody who causes harm to our brothers and sisters, knowingly so, with false representations of what they do, I have no mercy in how I address them. Medicare Advantage is a scam. I repeat, Medicare, even if you enjoy Medicare Advantage now, at some point, when your particular pool stops making the kind of money that they want to make for their shareholders and executives, as was pointed out in this article, they cancel plans on the fly. They'll say, okay, next year, this plan no longer exists and you have to re-up with some other plan. It's never about the patient. It is always about the Medicare Advantage private insurance companies making money for their shareholders and the execs. So please, folks, if you are in the house, if you are in the process of getting Medicare by December 7th every year or in December every year, please, 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 even if it costs you more, your life is worth more than saving a few dollars. Please refrain from using Medicare Advantage. And if you have the wherewithal, find out what it will cost you to get to hell out of Medicare Advantage while you can, while you still have your health. Because those, and they are scumbags, all of them, even the ones that have a pretty face on, because again, the premise is you get good treatment until your particular plan starts losing money. And you are the ones that pay the price. Never will they pay the price.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.